and welcome to Wimpole Street Dental Clinic. My name is Christian. In the following small video, we would like to show you how Invisalign works. That means from start to finish, which techniques we employ, which records we need to take in order to facilitate a predictable result. Thank you so much for your time, and we really hope that you enjoy the video.
Invisalign is an invisible way to straighten your teeth without braces using clear removable aligners. No matter if you want to correct crowding, turn rotated teeth, close gaps, or change a crossbite, this method offers lots of possibilities. It is also possible to make space for future implants and to correct a deep bite. You will be fitted with removable see-through aligners that have been specifically crafted to fit your teeth. Before a treatment plan can be created, your Invisalign provider will take an impression or scan your teeth. After diagnosis, a detailed treatment plan will then be developed using CleanCheck, a virtual 3D treatment plan. So you can see how your teeth are expected to look like at the end of your Invisalign treatment before it even begins. The movement of your teeth can be planned and regulated precisely. As you progress through the series of aligners, your teeth will begin to move step by step. Beside this, you might need an interproximal enamel reduction. This interproximal enamel reduction is performed carefully, in this case, for example, 1.3 millimeters. It will be conducted with small discs or polishing stripes. After the enamel reduction, teeth should be fluoridated. Sometimes tooth-colored bumps, so-called Smars force attachments, are placed on teeth in order to control tooth movements. So the teeth can be rotated and shifted easier. The aligners will gradually cause your teeth to shift their position slightly over a period of 2 weeks. Every 2 weeks you will change the aligners for a new set. In the following you see some treatment examples, starting with a simple case. The patient's wish was to close the gaps. This patient wanted to close the gaps too, which was possible with 14 aligners within 6 months. Here you see a patient with the aim to remove the crowding in the front. This is the patient after the treatment with the duration of half a year. The patient is now in a stage of refinement. This patient suffered from severe periodontitis, therefore his teeth have extremely shifted. An enormous improvement could be performed by a periodontitis therapy, followed by an Invisalign treatment. Thank you for your attention.